So no one can see her, but this is Debbie. Would you like to be in the... There we go, yes. Right, so this is Debbie Jeans. She's one of the directors of Rolf and Innovate Gyms here in Roy. Obviously, I'm Kudzi with Muzo Fitness. And we are talking about exercise and pregnancy. So obviously for the ladies, what kind of questions will ladies have or should they be asking when they become pregnant and are either already exercising or considering exercise?
Okay, well, there's basically two types of women who fall pregnant.
Okay.
There's those who are already exercising, and then there's those who perhaps are not exercising but feel that pregnancy might be a good time to start. So depending on what that situation is, if someone's been exercising, then it's great. They, once they've been to the doctor and been checked over, and they can continue basically doing what they were doing. Or if they want to start exercise, then there's a whole lot of guidelines that we use from the American College of Gynecologists that we use to safely train the ladies when they come, if they come into the gym.
Okay.
Or come to a personal training session or whatever.
Okay. So the lady, she decides that she's pregnant now. She doesn't decide. She is pregnant.
She finds out she's pregnant.
She finds out she's pregnant. Oh my gosh. We're going to do 6 months again. and so she's been to the doctor. The doctor says, go ahead and exercise. How much training should a lady be thinking about? How much exercise should she be looking to get, let's say in a week?
Okay, well, I think the way to think about it is you can think formally or informally. Informally, if you look out in the rural areas where our women, they'll be in the fields and they'll be exercising most days. Yeah. Then they fall pregnant and they will continue to do that up until sometimes a few hours before delivery. They'll go and have the baby and they'll be back within a couple of days. So if you look at that in a gym environment or in a formal exercise environment, it's outside walking or swimming or whatever, it basically means that when a woman falls pregnant, her body is going through physiological changes which are the same actually as an unfit, unpregnant woman who has started an exercise program. Okay. So the whole physiological training system of a pregnant woman is for labor, because labor is exercise. So obviously the fitter you are when you give birth, the less chance you have of having complications, or if there's complications, then you have a much better chance of things working out. You've got good muscle endurance, you've got staying power, you're able to push when you need to push that baby. So physical exercise informally could be anything. It could be housework, it could be gardening, it could be anything. But as long as it's regular, it's using the big muscles, it's getting your heart rate up a little, you're breathing deeply, you should always be able to hold a conversation. Okay. If you're exercising too hard and you really can't hold a conversation without taking a couple of breaths, that's probably too high intensity for the normal pregnant woman. Formally, American College of Sports Medicine says should accumulate about 150 minutes of moderate exercise a week, which translates to about 30 minutes of moderate exercise a day. Okay,
so for the lady that goes kind of to work and then she wants to get her gym clothes on, that's the formal exercise you're talking about of 30 minutes or 150 minutes a week?
That's a very good question, because we get, often we get locked into that, so then we don't exercise because we haven't got the half an hour or the 150 minutes formally per week. But what the research shows is that if you do a 10-minute walk in the morning, 10-minute walk at lunchtime, and a 10-minute brisk walk in the evening, it's the same as that 30-minute stint that you do all at once. Okay. Basically the effect is the same. So really it's thinking about being active in the day when you're pregnant. Sitting for long periods of time or lying for long periods of time is not good at the best of times, but certainly when you're pregnant it's even worse. You've got a lot of weight pushing down and the venous return is not there, so you've got swelling in the legs and that kind of thing. So for circulation and general well-being, it's really to think active. Okay. But if you wanted to formally add up the minutes, then 150 minutes a week is a good guideline.
Okay, cool. I was going to make a joke about Venus and Mars and stuff, and I decided no.
Why not?
We'll try to keep it professional. Innovate.
Okay. Come on, what's the Venus and Mars?
No, I don't know. You just said Venus. I was going to say something about Venus.
Oh, okay.
Yeah. Okay, so we'll cut that out. Daniel, we'll cut that out. That's the nice thing about this. We can goof around. Okay, so what are the general precautions that someone should take Obviously, the doctor's going to give them tons of
Clearance.
advice. Yeah, clearance, and
Okay.
and the doctor will know your specific situation and what you need and don't need. But kind of generally, what would be precautions that women that are pregnant and exercising should adhere to?
Okay, well, first of all, obviously you've got the doctor's clearance, because the doctor's checking things that obviously we can't check, and also just keeping an eye on his patient, her patient. So once you've got someone and they've been cleared, let's say if they've already been exercising, not a problem. And basically the recommendations are, if there's no previous history of preterm delivery or eclampsia, which is high blood pressure in pregnancy, or any complications, if there's no history of that and they have been exercising, whether they're runners or they, you know, what they're doing, no problem, they can continue to do that. It's not a problem. Obviously you're not trying to win the world record. You don't really want to be going at incredibly high intensity, so they can continue. The only sports that you shouldn't really do is anything that's going to perhaps put you at risk for falling, so cycling.
Rugby's out.
Rugby's out, definitely.
Okay.
Yeah.
Okay.
Contact sports, yeah.
Okay, yeah.
Judo.
Yeah.
And, you know, obviously things, extreme sports, you know, makes sense. But everything else is absolutely fine if they have been training before they fall pregnant. Now, for the ladies who haven't been training, they fall pregnant, now they want to get serious about it, then really what they want to be doing is they want to be doing exercise, like I said, where they're able to hold a conversation. It's very easy to do. You don't need heart rates or anything. And heart rates actually are not that accurate with pregnant women because the resting heart rate's up anyway. So it's really going on how you feel. And you should feel that you're getting a nice workout, you're breathing, maybe you're sweating, and you know you are able to sustain the exercise for about 20-30 minutes, no problem. That's great. That's you know, that's it. I think also resistance training is a good thing, because obviously with pregnancy, things like center of gravity change, you're having a lot more work having to be done by the muscles on the back to balance that, to keep it up. Also, you've got you know, joint issues that are happening with that hormone. Relaxin makes everything quite lax. So even if you're fit, you've got to be a little wary that the exercise that you do should be something that you can predict. So you don't want any sudden turning or sudden jerking that, because those ligaments, you can gently or strain them just a little. So those are the main things with exercise, but basically the best exercise for pregnancy is the exercise that you're going to do. So whether that be walking, whether that be swimming, whether that be the housework, it's gardening, it doesn't matter. It's just something that, you know, you're moving and you're generating some heart rate elevation, and you're breathing, feeling really good. That's great.
Okay, cool. And then do you have any other recommendations?
For pregnancy, the general wellness health thing. Absolutely. I think, you know, in pregnancy, one of the problems, of course, is that we think that it's this wonderful natural state of affairs, but actually it can take its toll on the body. So I think the pregnancy is one of the times in your life that it's really time to get things together. You know, you're doing it not just for yourself, but also for this wonderful human being on board that you're growing. So the other thing is nutrition is very big. And, you know, sometimes you can get pregnancy-induced diabetes, and that can come on because the toll on the blood sugar and trying to keep it constant, insulin, things can go, you know, a little bit AWOL. So it's a very good time to cut down on the processed food, on the sweets, too much sugar, too much refined carbohydrate. Eat the healthy, real food. And of course that's going to help with your weight as well. You don't want to be putting on too much weight in pregnancy. So you want a healthy weight gain, and basically, you know, if you're moving and you're exercising and you're eating really well, which is good for your insulin, so you're not getting your blood sugar up and downs. So that's an easy way to know that you're not overly hungry every hour. You know, you're eating some really good healthy fats and your salads, your veggies, and a lot of nutrient dense food. Then that's good for you. And of course, hormones. It's a time in your life when your hormones are taking over now.
Yeah, I have two sisters.
Oh, you've got two. Then you know too well.
I love you guys.
So, you know, so in pregnancy, you know what, it is it's a beautiful place to be, but it's also, you can get very moody, and I think that exercise and nutrition certainly have a huge impact on that.
Mm-hmm.
They keep your energy levels good, you're happy, and stress management is a good thing. Things like there's some lovely classes like yoga and Pilates adapted for pregnancy. Absolutely fantastic, because it's very much a mind-body thing. But you can bring the mind-body side of pregnancy into any exercise, and you can walk, whatever exercise you're doing. It's just really about feeling good about yourself, getting those endorphins flowing, and don't underestimate the baby's also getting all those good hormones and benefits of whatever you're doing.
Okay, I know at the beginning of our talk you said that you'd have moms in the rural areas that would go back to work not very long after. What would you say, or what would you say is a
good time?
How soon do you think a mom can expect to go back into her usual routine, even if it's just maybe walking around with the baby in hand?
Okay, very good question. So again, it goes back to what was she doing, while she was pregnant.
Mm-hmm.
So we're talking about the ladies in the rural areas. I mean, for them, in a couple of days, they're back there, no problem.
Okay.
And I don't know if you're aware, but certainly pregnancy and elite sport has shown now that you can train almost up to just before delivery. All you would do is so for example, there's a 10,000 meter world champ from Scotland, I think, many years ago, and what she did was she basically was pregnant, and then at about 7.5 months she took her training into the water, so very low impact, and obviously taking gravity away from the heaviness of baby. And I think she won the gold medal like 2 weeks after the baby was born. Obviously that's extreme and brilliantly handled and everything, but it just goes to show that depending on what the training is and and the state of pregnant mum, that if she's able to, and even cesarean sections now, in the old days, we used to lie in hospital for a week. Now, your obstetrician's got you up and moving as soon as possible.
Okay.
So, if a pregnant, if a new mum can walk, then she must walk. She must basically, obviously not do anything too strenuous, but if she can walk, then she can start informally exercising as soon as possible. So the more activity she does, of course, the quicker her recovery.
Okay. Do you have any recommendations for people that where they can find out more information about exercising and pregnancy? So obviously we're going to have this video up, but a woman should obviously go see her doctor. Her doctor is probably not going to send her to just any old personal trainer. What kind of things should people be asking about when they go to their doctors in terms of either beginning exercise after pregnancy? Like, who should they be trying to go see?
Okay, well, I think what normally happens is your gynecologist normally likes you to wait about 6 weeks afterwards, because it takes time for everything really to settle down, the bleeding to stop, and it's quite a huge process to have a baby. So it's about 6 weeks is the recommended time that you really don't want to be doing anything strenuous other than your walking and all the rest of it. And if you've had a good childbirth and it's been fine and few complications and everything, then you'd follow your doctor's advice. But basically, if you can walk, then you can work around that. But the 6 week is the cutoff for really things are starting to get back. And of course, you're going for checkups as well, so you'd always stay in with the doctor. But if people wanted to go for themselves and have a look, then the website's American College of Obstetricians and Gynecologists, very, very good guidelines there on exercise and pregnancy.
Okay. All right. I don't know if you have anything else you'd like to add, Debbie, or?
Just that pregnancy is not what it used to be. It's not. No. What I'm saying is, it is not a state of helplessness. And it's certainly not a time that you should just sit back and not do anything. It's you're very, very lucky if you fall pregnant. Firstly, because I know it's It's not so easy these days. We take it for granted. So it's a wonderful opportunity to really get your life really good, and your health, your wellness, your mental, your physical state, your relationship with your significant other, and really help this baby to grow, and at the end of the day help this baby into the world, you know. And exercise is not a guarantee that you're going to have no complications at birth, but it has shown that there are less complications, and it has shown that the mum has a lot more confidence, and that she's able to bounce back a lot quicker afterwards.
Is that what you can end on? Yeah. No, it's beautiful. That's
okay.
Beautiful. Right, so guys, thank you so much, Debbie, for coming on the show. My cell phone.
Absolutely.
And giving us some solid information there. So if you are planning on turning food into a human, please listen to the video. There's lots of websites that Debbie has shown, and I'll put these down in a link on the YouTube video. And please feel free to give us a call or get a hold of us. I'll have Debbie's information in there as well. And you know, you're not by yourself. There's lots of information out there to help you out. And thanks a lot.
Thank you, Kudzi.